Have kind of a fun topic today. When you leave today, you're going to memorize this supplement called Vinpocetine. I suspect that many of you have never heard of it. You've probably never seen it. It's very new to you. And that's part of the reason I wanted to do this. I've lectured on this and talked about it in the past. I was recently contracted to do an education for a large group of doctors, mostly in Utah, about this supplement. And I've lectured all across the country about this. The last time I gave a lecture about this was down in San Diego in 2023, specifically about the use of vinpocetine and brain health. Okay. So, with that in mind, I think I'm just going to go ahead and get started. We got a couple of people that are still logging on, but they'll catch up with us here pretty soon. And then I'll be able to take questions at the end. Okay. So, to start us off, I'm going to talk about a nutraceutical challenge using this supplement called vinpocetine. Now, what's a challenge? I'm not going to spend a lot of time talking about a challenge per se, other than it's using higher doses of this supplement in a short window of time so we can see what the benefit is. Okay? So, with that in mind, I'm going to go ahead and get started. My goals of this masterclass is to introduce you to vinpocetine. It's a nutritional supplement. If you went on Google right now, you'd see many websites that sell vinpocetine. It's kind of a specialty supplement. If you go into a big nutraceutical store, vitamin and mineral store, they'll have it. If you go into a small one, or if you go to Fred Meyer, Walmart, you probably aren't going to find it. I'm going to talk about what symptoms and what kind of physiology we contemplate when we choose to use this supplement. I'll define a challenge. Okay, we'll get there. And then I'm going to introduce to you my clinical experience and thoughts about why I use this particular supplement in dementia, in brain fog, in sundowning, and in people who have kind of complex neurological challenges. If you just type vinpocetine into a Google engine, this is what you'll see. Life Extension, which is a very reputable company, has a supplement of 10 milligrams. The second one, Source Naturals, I've used them for a couple things. They have 10 milligrams. Now look at this. It's 120 tablets or 100 tablets, and it's going to be like 20 bucks. Dirt cheap. Piping Rock uses 30 milligrams. I've never used that particular supplement. I don't know anything about that supplement. And this one I use all the time. I've personally used this supplement for about 3 years. It's called Neuro 2. I have an allegiance to Apex Energetics. I'll explain why I have that allegiance at the end of my presentation. This particular supplement is called a phosphodiesterase inhibitor. When you think of medicines, there's a name of a medicine and then they belong to a class. A class of medicine is based on what it does in the body. Phosphodiesterase inhibitors, most of you probably have never heard that term, but you're very well aware of phosphodiesterase inhibitors because of these two medicines, sildenafil and tadalafil. That is Viagra and Cialis. Now, everyone knows what Viagra is and knows exactly what it does. Viagra dilates blood vessels downstairs in the human body. Vinpocetine dilates blood vessels in the brain. It has a strong affinity to neurological tissue. And so, is it natural? No, it's actually semi-synthetic. That means that the plant that it comes from is called the vincamine plant. It's an alkaloid that's part of the periwinkle family, but it has been modified because of clinical studies. So it is very much a pharmaceutical-based product. That's why it's called semi-synthetic. It's based on a plant, but it's been altered by the pharmaceutical industry. It's been used for decades in Europe and Asia for cerebral vascular disease and cognitive support. It's actually a prescription all around the world, and it's over the counter in the United States. Isn't that interesting? I'll explain why in the United States. Its tissue of affinity is brain tissue. So Viagra has tissue affinity in the penis. That's why it works so well for erectile dysfunction, because the tissue in the penis has a strong affinity towards that phosphodiesterase inhibitor. Well, vinpocetine is very analogous to that. It has tissue affinity in the brain, and it improves cerebral blood flow without raising blood pressure. That's important because caffeine improves cerebral blood flow. Ritalin, which are stimulants, improve cerebral blood flow because they clamp down the blood vessels in the brain. The problem is many of these will also raise the blood pressure of the individual. Because it improves cerebral blood flow, in medicine we use the term perfusion. It increases perfusion of blood in the brain. It increases oxygen delivery in the brain, which means it also increases nutrient delivery in the brain. So if you have a patient that you're giving vitamin B12 or vitamin B1 or vitamin D, and you combine it with a little bit of vinpocetine, isn't that a beautiful thing? We're now going to improve the delivery of that specific nutraceutical in the brain tissue. The Alzheimer's Association in 2023 funded a look-back trial. I believe this happened in California at Kaiser Permanente. And they were saying if we looked at men who regularly used Viagra, are rates of dementia as high as men who never filled a Viagra prescription? Well, this is not a cause and effect style study, but what it looks at is what's the relationship. If we're giving a nutraceutical to a client that improves blood flow in the penis, is the relationship to the brain? And they actually showed a slight relationship. They say, hey, that's interesting. PDE5s like Viagra might have benefit for individuals in dementia just because it increases blood flow. Well, guess what? Why would we mess around with Viagra? Why don't we just use vinpocetine that's been studied for 50 years in neurology practices and have been shown on MRI to improve blood flow to the brain? Okay, so if you are a fan of AI like I am, I did about a 2-hour conversation with ChatGPT about vinpocetine. And I want to show you some of the screenshots of what it says. Vinpocetine number 1 improves cerebral blood flow without raising blood pressure. I already talked about that. So look at this statement right here. This is very relevant for individuals who have chronic cerebral hypoperfusion. That means very low levels of blood flow to the brain. It's very important for people who have small vessel disease. Man, I get MRIs of people all the time, and the radiologist comes back and it says age-related atrophy of the MRI of the brain, age-related atrophy and evidence of small vessel disease. Those are TIAs. Individuals who've had strokes or individuals with age-related vascular decline. That's who benefits from this supplement. This is very good evidence. Now, let me ask you, how many have ever even heard of it? You probably don't even know what it is, right? Isn't it cool that you're learning about it now? Vinpocetine improves oxygen and glucose utilization in the brain. That is so cool. And you look, it helps neurons survive in an environment where they have compromised blood flow to the brain. Those are things like atherosclerosis and microvascular damage and endothelial dysfunction, right? Great science behind this supplement. It's neuroprotective. Do you ever even hear of supplements that are said these are neuroprotective for the brain? It decreases glutamate-induced neuron damage in the brain. Glutamate-induced is sometimes referred to in the lay literature as fight or flight. Individuals who are really wound tight and you can't get them to settle down and they're in fight or flight mode may have some benefit for those individuals because that might be a vascular problem in the brain. So this is particularly important for our family and our friends, or for you if there's any risk of vascular cognitive impairment, where there might be this low-grade blood flow, low-grade reduced oxygen delivery to the brain. Vinpocetine has an anti-inflammatory effect and an antioxidant effect. Well, how cool is that? We hear people say, I got to take CoQ10, I need the antioxidants. Or I want to take glutathione or resveratrol or PQQ or CoQ10 or methylene blue because of the antioxidant. It has antioxidant benefits and anti-inflammatory benefits in the brain. Oh my gosh. I almost sound like I'm making this stuff up. It sounds too good to be true. Trust me, I'll keep pounding through this. I asked ChatGPT, how is vinpocetine different from other vasodilators, things that improve blood flow to the brain? And you'll say, well, the interesting thing is that it's targeted to brain tissue. Whereas if you took a nitric oxide booster, we hear about nitric oxide all the time on Instagram. I'm actually sick of seeing it. I'm sick of seeing the Instagram posts about beetroot, how powerful beetroot is, blah, blah, blah. Listen, that stuff pales in comparison. And they're charging like 5 times the amount for beetroot as you could get it vinpocetine for. And it's not specific to the brain. It's even better than stimulants. So I use the example of caffeine. Caffeine is not brain specific, but vinpocetine is. It doesn't raise heart rate. It doesn't raise blood pressure. It's actually neuroprotective and anti-inflammatory. How cool is that? So are there risks? Well, of course. In medicine, you never get something for nothing. There's always a trade-off. So let me tell you what the trade-offs are. I would never use it in pregnancy. Do you know why? Because I don't ever use anything in pregnancy. So if anyone on this call is pregnant, don't use vinpocetine, right? If you're nursing, don't use vinpocetine. I just wouldn't do it, right? The next one is if you're currently using blood thinners like Eliquis or Xarelto or Coumadin, then I have an added layer of caution. It doesn't mean that I would never use it, but it means I'm aware of that and I'm going to be careful. I might start with more modest dosing and measure the response. Anyone who already has low blood pressure or who has POTS. Now, I just told you the research says it doesn't lower blood pressure, but I still want to have an element of awareness or caution. And people with POTS, I saw a 13-year-old in my office last week with POTS. Poor kid, hasn't been to school for months, holed up in bed. It's such a miserable condition. And if anyone's always falling down, I would be a little bit more aware of it. Doesn't mean I would never use it, but I'm just aware. Anyone who's in this window of having an acute stroke, specifically a hemorrhagic stroke. Remember, strokes have different flavors. One flavor is a blood clot in the brain. Another flavor is a blood bleed in the brain. If there's a bleed in the brain, I don't necessarily want to give them something that increases blood flow to the brain because I'm going to make that brain bleed worse. So we know there's windows. When someone has a stroke and it looks like it's a hemorrhagic stroke, then I would say, you know what, we're not going to use vinpocetine for 6 months. And then I might get an MRI to just look at that change. And then after I start vinpocetine, I might get an MRI 3 months later, right? So there's an element of precaution. Anyone who has a history of vertigo, I might be a little bit more aware and a little bit more cautious of the use of vinpocetine. So why? One of the side effects could be headache. We know that headaches are often related to how much blood flow is or is not going in the brain. There's a whole auto-regulatory system of blood flow in the brain. And so again, these aren't reasons not to use it. These are reasons just to be aware of it. If people have flushing, that means if they have flushing syndromes, they already dilate their blood vessels in certain part of their bodies, which causes the flushing. So I'm aware of that. Dizziness, I got to be aware of. GI discomfort. This is something that's listed on the label for vinpocetine. I've never had anyone that had GI discomfort not take this. And in my opinion, half the world has GI discomfort right now because of irritable bowel and acid reflux and all kinds of challenges. So I would just be aware of it. I wouldn't use it before surgery. So we don't use anything before someone goes into surgery because surgery is risky anyway. There's all kinds of problems that happen. So we would just be careful with someone who has a pending surgery. I already talked about POTS and blood pressures. And because I prepared this presentation for healthcare providers, then I just tell them, just be aware of your patient, talk with them about it. Vinpocetine has a very short half-life. That means if I take it now, depending on if I take a liquid form of it or a capsule form of it, it's going to be gone anywhere between 2 and 6 hours. It'll be metabolized. So if I'm aware of that, then I can use some good clinical judgment when I'm prescribing this for my patients. Some of my favorite supplements, one of them is called Nitric Balance right here. You'll see it has vinpocetine in it. And when we talk about a challenge dose at the bottom of your screen in red, you'll see the challenge dose of this would be about 10 milliliters 2 or 3 times a day. And I tell my patients, take this and go on a walk. It is so unbelievably powerful of how good a walk is under the influence of vinpocetine, because the walk gets a little bit of blood flow going anyway, and then vinpocetine just opens up the brain. It's actually a fantastic experience. I'm going to come back to this slide in a minute and talk about these other ingredients, especially in the context of individuals who have dementia or terrible brain fog. So I'll get there. This is the capsule form. So I'm going to go back. Liquid form, which is, we call this a liposome, and it's faster acting, it's faster onset, and you burn through it quicker. So its half-life is only going to be about 2 or 3 hours. Whereas if someone takes a capsule form, this half-life is probably 4 to 5 hours. Okay. So this is the form right here, and then here's vinpocetine. You have to read the labels. You have to really understand what's in it. So this has vinpocetine 10 milligrams, just like many of the other supplements that you saw on that I shared from Google. Now the challenge dose, if you said, I want to try this, it's over the counter. You don't need my permission. I told you what to be aware of. The challenge dose might be 2 capsules of this 2 or 3 times a day, and see how you like that. Like I say, I've taken this particular supplement for probably 3 solid years. Pretty amazing supplement. I love it. Okay. So the half-life, meaning the half-life is defined when you take this supplement at 10 milligrams, how long does it take for it to be metabolized to only 5 milligrams in the bloodstream, right? How long does it take for your body to reduce it by 50% or by half? Well, it has strong uptake in the brain at a very short half-life. So it's 1 to 2 hours. So moderate dosing can help optimize the perfusion in the brain and create that neuroprotective dose. And maybe a little bit higher dosing, meaning several times during the day, could make a difference for an individual, right? So let me show you this. When would higher dosing make sense? Well, if someone's ever had a stroke in their history, this is what it's used for in Europe. If you had a stroke in Europe, once the acute phase of the stroke is resolved, those doctors write vinpocetine for their patients on a regular basis. Vinpocetine is the #1 pharmaceutical in Europe, meaning it's a multi-million-dollar drug, maybe into the billions. I couldn't find data on what the financial impact is in Europe, but this is huge. And it's used in cerebral patients, stroke patients. So a nutraceutical challenge would be, hey, it's over the counter. If I understand the risks and the potential benefits and what to be aware of, could I take this 2 or 3 times a day and be aware of my dosing? Now, I'm not anyone's doctor. I'm not telling you what to do. I'm teaching you, I'm educating you, because I went to Costco this morning, and in Costco, I walked through the supplement section. It's enormous. There's a million supplements, and people are buying these supplements all the time, but they don't really know. They're listening to the people who have the samples. So they're using samples. They're getting a brief description on Google that tells them what the description is. I'm telling you that this nutraceutical is awesome, but you're probably not going to find it at Costco. Okay? Across decades of use, I'm not exaggerating, Eastern Europe, Russia, Asia, researchers have measured things like, we're going to test for hepatic toxicity, liver toxicity, renal toxicity, cardiac arrhythmias, coagulation abnormalities, neurotoxicity, people getting worse cognitively, and rebound ischemia, which means rebound blood flow issues. And after decades of trials, none of these problems have emerged as consistent or dose limiting responses when used in short term, okay, or even used in long term. This is actually quite safe for many individuals to take. So, why in the world do we not use this in the United States? Well, look at this statement. I asked this question, ChatGPT, if this is a prescription all across the world and it's only a nutraceutical in the United States, why don't we use it? Why isn't it endorsed by the vascular organizations? Why doesn't the American Academy of Neurology say, hey, we like vinpocetine? Here's the statement. Vinpocetine is a conventional drug. He doesn't even think it's a nutraceutical. It's a conventional drug, just not in the United States. It was developed as a prescription pharmaceutical for the treatment of cerebral vascular insufficiency, post-stroke recovery, vascular cognitive impairment, vertigo, tinnitus, and ischemic brain conditions. Those are the clinical indications under which it was developed, okay? The use of vinpocetine has been studied in hospital-based neurology practice, and it's often prescribed by neurologists outside of the United States for brain support. The reason it's not a prescription in the United States is because it failed the American drug economic model, not the science model. It passes the science model, but not the economic model. So what that means is, because it's over the counter and there's no restrictions to make it, there's no patent, there's no incentive. Think of the big weight loss drug right now that have come out, Ozempic and Mounjaro. They cost $1,000 if it's not covered by your insurance. So the drug companies keep these under patents and no one can manufacture them because of the patents. Well, guess what? That's where vinpocetine failed. It failed the economic model, not the clinical model. So it's just over the counter, okay? So there is no pharmaceutical patent, but if someone was to go get that patent, it would cost them somewhere between $300 and $800 million to get FDA approval for that drug. If there's no approval, then there's no drug approval. The FDA is not going to come out and say, hey, this is indicated. Therefore, it's now a dietary supplement, and therefore, it's a nootropic, okay? So what are the studies? You can find this on pubmed.gov. PET, that stands for positron electronic transmission studies of the brain uptake and regional distribution of vinpocetine in human subjects. So you're looking at how much blood flow does the brain get when you get vinpocetine. Now you'll see in this picture, this area that's blue right here where my mouse is, this is where a stroke has occurred, right? Terrible stroke, no blood flow in this section. But if you look at the rest, this color graph that goes from brighter and brighter shows, well, how much blood flow goes to the brain when we use vinpocetine. This is when vinpocetine is given IV. So someone has a stroke, we give them vinpocetine IV, and then we go take an MRI of their brain and it lights up their brain. Why? Because it's Viagra for the brain. Just like Viagra improves blood flow to the penis, Viagra improves blood flow to the brain tissue. Here's another trial. Effects on vinpocetine on the redistribution of cerebral blood flow and glucose metabolism in chronic ischemic stroke patients. Another PET study. But you look at the names on this study, this is a European study. Okay? So it says the findings indicate that 2 weeks of giving IV vinpocetine treatment can contribute to a redistribution of cerebral blood flow. In chronic stroke patients, the effects are most pronounced in the regions of the brain where the drug is taken up the highest amount. Interesting, isn't it? Here's another one. The investigative use of vinpocetine on cerebral blood flow. Conclusion of this study. Vinpocetine improved cerebral reserve capacity in both patient groups and favorably influenced the cognitive status and general conditions of patients with chronic hypoparathyroidism. perfusion. That means chronic low blood flow. The authors recommend the use of vinpocetine in the treatment of patients with mild cognitive impairment. Well, darn, wouldn't that be nice to know for every one of you running assisted living centers? What about the other ingredients? Well, I'm going to talk about those. How about xanthate nicotinate or xanthanol nicotinate? I'm not going to get into the studies, but I want to show you the ingredients. Here's vinpocetine that improves microcirculation. Xanthanol nicotinate is a derivative of niacin, and niacin is vitamin B1, and it's been shown in clinical trials to reduce blood viscosity for both peripheral and cerebral vascular support. Alpha GPC is what we use in people with dementia. When you have patients with dementia that are on donepezil or Aricept, they're getting something that improves choline. Well, that's what alpha GPC is. ATP improves cellular support, and huperzine A. Did you know that huperzine A is the natural form or the natural comparative of donepezil or vinpocetine? It improves neurotransmitter support, right? So for alpha GPC, we want more choline. We need more acetylcholine. It strengthens the neurological health of the brain. That's been studied in clinical medicine like crazy. That's why there's a pharmaceutical agent called donepezil. Well, what if you don't take the liquid form? What if you take the capsule form? Well, feverfew is a nutraceutical that has antiplatelet. That's what aspirin does. And decreases prostaglandins. If you were to look up feverfew on the internet, it would say, hey, this has been studied in migraine prevention. Butcher's broom improves venous tone and improves the inner lining of a blood vessel so you don't get capillary leakage. Ginkgo, everyone knows that if you look up ginkgo, it's in every nutraceutical product for brain health. It's because it improves nitric oxide signaling. Nitric oxide is another potent vasodilator. So what beetroot tries to accomplish, right? Cayenne powder, you've probably heard people use cayenne for blood pressure issues. Magnesium, there's over 300 mechanisms of action where magnesium is so beneficial, specifically to help relax smooth muscles, okay? So now what I'm showing you is why would I choose this supplement Neuro 2 over just straight vinpocetine that I could buy on Google? It's just because the quality of the supplement, okay? That's the main reason. So again, if I look at the toxic threshold for the other ingredients, if I look at feverfew, butcher's broom, ginkgo, cayenne powder, ATP disodium, xanthanol nicotinate, and you do a search in Google or in your AI or your chat GPT and you say, are there any known toxic thresholds? So when I take this in certain amounts, it's going to get toxic in my body. The answer is no, 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 no. These are all very, very safe. And I created this because I said, I wanted you to know what are the upper limits of the dosing and what are comments like, what does it do? This gets very technical. You can see that I produced this for doctors. But I think that in the end, I just want you to know, you don't have to know every bloody detail about this, but you can know, hey, there's a lot of research for these different nutraceuticals and how safe they actually are in the human body. So a nutraceutical challenge then is where we either use Neuro 2 or nitric balance in higher dosing, because the dosing recommended on the supplement bottles are very conservative. And they might be insufficient to alter physiology during periods when someone says, dang, I got terrible brain fog. So how could this be used? Let me tell you how I would use it. I have a daughter that just finished nursing school and she's taking her national nursing certification test. It's called the NCLEX. I tell her, when you study, I want you to take vinpocetine. When you go take your test, let's take a bigger dose of vinpocetine. I want that blood flow to your brain to go up. I want you to be crisp and sharp when you take that test. How about individuals who might want to do neurological testing or individuals who are sundowning in our assisted living centers? We could ask our doctors, hey, could I get 2 doses of vinpocetine in the early afternoon and before bed? My patient has microvascular disease and I want them to have some vinpocetine. It's uber safe, and I'm trying to prevent sundowning in the evening. I won't mention names, but I think one of our participants, I taught them how to do a nutraceutical challenge using a ketone. And I said, use this ketone in the afternoon when your resident is starting to fall apart and kick the cat and get angry and yell and won't go to bed. Use a ketone. And they said, oh my gosh, that was actually remarkable how much it made a difference. Guess what? Vinpocetine is another option that if a doctor was willing to prescribe this for a patient could make a significant difference for them, and the safety profile is phenomenal. I just went through that. So if I'm using the liquid version, here's the challenge dosing. This is not what the label said. The label says 5 mils as directed. And I would say use 10 mils 3 times a day. Or if you're using the capsule form, I'd use 2 capsules 3 times a day. That's how Randy Vaudry doses this. Now remember, I'm not practicing medicine or telling you what to do. I'm telling you what my experience is, and I'm training you about an over-the-counter supplement. So what could happen with a vascular challenge? Well, in my experience, people will say, I have more energy. I really like that improved mental clarity. That did as much as caffeine ever did for me. And yet then I don't have trouble falling asleep. So this is the caffeine without the stimulant. It lowers my brain fog. It makes my mood better. Rebecca says on here, hey, maybe this could be good for mental health patients. No question. No question. It improves motivation and performance and can lower headaches and migraines because remember, feverfew has actually been studied in migraine headaches, and it's one of the corollary nutraceuticals in vinpocetine. So I believe that many of the dynamic predictors of brain health are kind of based on blood flow to the brain, what's your immune system doing, and how functional is that neuron. Well, this particular supplement has focus right here on blood flow to the brain tissue. In neurological medicine, I was taught to differentiate. Is it a mental health challenge? Or is it a cognitive challenge like dementia? Is it a motor function issue like Parkinson's disease or a tic? Or is it a sensory perceptive disorder like neuropathy in the feet? Well, every single one of those do better when patients have more blood flow to the brain. So back to what Rebecca says, of course it could be used in some mental health patients as a trial. We want to try to improve blood flow to the brain. So instead of saying we use vinpocetine to treat stroke patients, that's what they say in Europe. I ask myself, well, what are the symptoms that individuals are experiencing? Are they on the spectrum? Do they have multiple sclerosis? Do they have attention deficit? Do they have anxiety or ADHD or depression or whatever? Remember, each one of these in some way probably has some roots in poor blood flow to the brain or compromised blood flow to certain areas of the brain. Could vinpocetine then be considered in those instances? I think there's an argument for it. So I showed you at the very beginning, if you just Google right now, these are common supplements. Now let me issue you a warning. If you Google vinpocetine, you'll get a whole bunch of supplements. And what Google looks at is Google knows vinpocetine is for brain health. So it will then propose all these different supplements that have been advertised for brain health. And when I looked at that, many of them don't have any vinpocetine in them. It's just Google knows, hey, people looking for vinpocetine knows it helps the brain. So I'm going to try to sell them all these other brain health supplements. Be intentional. Look at the label. So Life Extension, Source Naturals, Piping Rock. Again, why do I choose Neuro 2? Neuro 2 is produced in California. That's the factory that produces Neuro 2. I've actually been to the factory. California has a law I think it's called Prop 65. And Prop 65 says they have to have third-party testing so that if they say, here's the ingredients on this label, a third-party entity that's not part of that supplement company gets to test it and validate that it has all the ingredients that they say it has. That's worth it to me because these other supplements do not require third-party testing. So if you ever say, Vaudry's kind of a supplement snob, he has favorites, you better believe I have favorites. And some of the reason I have favorites, one of those reasons is there some third-party testing associated with that supplement? That's why I like Neuro 2 or Nitric Balance. Okay. I created a handout and I want to show you this handout real quick. And I'm going to post this on the community website. Will someone speak up and tell me that they can see that? I just want to make sure that it's visible.
Yep, it's there.
Okay, perfect. So what I did is I took my entire presentation and I reduced it down to a one-page handout that says, why in the world would we use vinpocetine? So this paragraph up top right here says, here's why we would use it. I just gave you the science. Here's the supplements that I would use, Ditric Balance and Neuro 2, and then here's the dosing of that supplement, right? Now, again, this is over the counter. I'm not prescribing. I'm not doing this. Brittany can't go in and say, okay, Randy said that we should put all of our patients on this. We obviously got to get doctor's approval and so forth. But I'm just giving you the data. I'm giving you up front. This is what the research shows, okay? And then look at this box right here. It says dosing ranges shown above reflect a higher threshold, which means practitioner-guided use would be important. So this is kind of max dosing in my opinion. You could use smaller dosing, but anyway, it's so safe. Remember, I just told you there's no toxic threshold for any of these ingredients in the human body. And then here's clinical indications. You could give this to your practitioners and say, hey, a practitioner might consider vascular support if an individual has all of these challenges. And then here's my disclaimer. The statements and recommendations in this handout have not been evaluated by the FDA, and they're not intended to diagnose, treat, cure, mitigate, or reduce any clinical symptom. This information is my professional opinion and my clinical experience alone. Individual response can vary. You just have to take that under advisement.